Hello friends, I am Dr. Sourabh Patwardhan from Nandadeep Eye Hospital PG Teaching Institute and FECO SICS Training Center, Sangli, Maharashtra, India. In our center, we have a lot of teaching activities which includes hands-on training as well. In this video, I am going to speak about a case of small pupil, and the plan is to implant a plate haptic trifocal IOL, and I want you to see how I did trench divide in this small pupil. So the idea here is to show that for trench divide you don't actually need a very long trench, just 4 millimeter deep trench is enough. So I have made a incision on steep axis. I am going to use a 2.4 keratom and I am going to use the sleeve for 2.2. So these are the Callisto markings which are there. You can also do the manual markings, and I am going to keep the iris retractors ready in case that during the procedure I need it anytime, and I am going to use Hylu coat so that I have some kind of viscomydriasis. But here you can see even after that pupil is still 4 millimeter, and I have to be really careful while doing capsulorhexis, as the edge of the capsulorhexis is under the iris, so I have to be really watchful so that the rhexis doesn't go out and no inadvertent stroke of the cystotome should cause that extension of the rhexis. One has to be very careful. So here the Hylu coat helps, as it maintains the anterior chamber during the capsulorhexis, and a good hydrodissection wave and nucleus rotation. So I'm going to use Centurion machine here with 60 millimeters of mercury IOP here, and this is the trenching. You can see I am going to trench deep in the central 4 millimeter, and it is enough to divide this softer grade of cataract. It's a soft grade cataract, so it's always tricky to divide it into nice separate pieces, because if you have these pieces stuck together, it's very difficult to take out the first piece. As you can see here, I am using the Sinskey as a retractor for the iris so that it doesn't come into the probe, and once I pull out first piece, it becomes easier. I'm going to make sure that I don't apply vacuum once the piece is emulsified, and also it is important to stay away from the margin of the pupil during phacoemulsification. So for small pupil cases, these are the important tips you should know. This is a soft grade of cataract, so hardly any phaco energy is used. It's most of phaco aspiration. During cortex removal, we have to make sure that we don't use sudden high vacuum in the periphery. That may cause cutting of the anterior capsule, and the remaining cortex will remain in the equator of the lens, which we have to avoid. And always retract the iris to watch for any residual cortex before you finish. And always have this low vacuum, pull out the cortex, pull it in the center, and then take out the entire chunk of the cortex, so we don't have any residual cortex left. I am going to use 1% hyaluronate for IOL implantation. This allows easy removal, and this is the plate haptic IOL. I am injecting through 2.4 millimeter incision, and you have to make sure that both the haptics are in the bag. So before you close, you must ensure that the capsule is covering these haptics and the IOL is properly in the bag. This avoids any refractive surprises or tilt of the IOL later. So it's important to remove the Hylu coat as well as hyaluronate also from the bag. Because of hyaluronate is a cohesive agent, just little bit of vacuum in the bag is enough to take it out in a chunk. So that's why I use this instead of methyl cellulose for these cases. So that's the end of the procedure. I'm sure that you have learned few tricks here, and watch these steps carefully. Of course, it's always better to use iris retractors or pupil expansion ring. Now for particularly plate haptic IOL, I will avoid pupil expansion ring because it may hamper the IOL insertion, which I will show in another video. Keep watching my videos and do subscribe. Thank you.